Hello, my name's Manali Kamdar. I'm an associate professor and the clinical director of the Lymphoma program at the University of Colorado Cancer Center. Today, at ASH 2025, I am going to be presenting on behalf of my other co-authors the 4-year follow-up of the long-term study called TRANSFORM. So TRANSFORM is a global randomized phase 3 study in patients who had relapsed second-line diffuse large B-cell lymphoma. And TRANSFORM compared Liso-cel, which is a CAR T-cell therapy, versus bone marrow transplant in high-risk patients. The net is that TRANSFORM was a positive study. Liso-cel, now called Liso-cel, was way more efficacious, also safe compared to bone marrow transplant, and is now considered the new standard of care for patients who have relapsed after one line of chemoimmunotherapy for diffuse large B-cell lymphoma. Upon completion of the TRANSFORM study, patients who were treated with Liso-cel had the ability to enroll into a separate long-term study called the LTFU study. We now present the 4-year follow-up of patients who were treated with Liso-cel on this study. So just so that my audience understands this a little bit more, the TRANSFORM was a randomized study, so patients who got treated with second-line Liso-cel, and there were also patients on the standard of care arm who had the ability to cross over to receive Liso-cel upon progression in third line. In terms of the overall survival, this is looking very good for Liso-cel. At the 4-year follow-up, the 4-year overall survival for patients who received Liso-cel was exceptional, and at this point the median is not reached. The 4-year follow-up is 62%. With regards to progression-free survival, the 4-year PFS for patients who received Liso-cel on the long-term follow-up study is 52%. So this is looking like it has curative intent and curative potential. With regards to the whole cohort, it's important to analyze whether we should get Liso-cel in second line or in third line. So patients who received Liso-cel in second line, these patients had a 24-month overall survival of 95%. On the other hand, patients who crossed over and then received Liso-cel in third line, their 24-month overall survival was 78%. Overall, these outcomes look exceptional for patients who got CAR T-cell therapy. It's important to highlight that at the long-term follow-up, there were no new safety signals that were identified. There were no evidence of second primary cancers. So overall, at this 4-year mark, Liso-cel continues to demonstrate its very high curative intent potential in patients who have relapsed diffuse large B-cell lymphoma.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.